going to be completely honest. Community engagement was not a huge part of my childhood. As an adult, service and work in the community has become a big part of who I am, and I cannot imagine my life without it. My name is Marin, Melloy, and this is my digital story. When I was a kid, both my parents worked, and they had their hands full with myself and my twin brother. While I had a wonderful childhood, it was more family-focused than community-focused, and I didn't realize how privileged I was until I was a teenager. When I was 12, my family moved from South Minneapolis to a town called Lindstrom, Minnesota. Lindstrom is located about 45 minutes north of Minneapolis and St. Paul, and I attended middle and high school there. In high school, I started to volunteer through National Honor Society, or NHS, and also through Student Council. I really enjoyed connecting with members of the community, especially by putting on events for kids at the primary schools and serving community meals for retired folks. I also ended up attending the National Conference for Student Council in Albuquerque, New Mexico, where I got to meet many young leaders nationwide interested in community service. Both NHS and Student Council allowed me to surround myself with people who were also interested in giving back to the community. Towards the end of high school and in my first couple years of college, I began to steer my service towards my future career interests, which for me is medicine. I first started volunteering in the emergency room at the St. Croix Regional Medical Center in St. Croix, Minnesota. I then volunteered in a medical oncology nursing unit at the University of Minnesota Medical Center. While this experience gave me exposure to the healthcare field, I realized that I was not challenged enough or connecting with patients, and that the service was very surface level. I discovered CESP during my sophomore year at the University of Minnesota. I thought that this organization would be a wonderful way to surround myself, again as I did in high school, with other students interested in giving back to the community. I've also enjoyed being a part of the CESP Leaders Board. As a board, we plan social events to get scholars together so that we can get to know our community more, as well as recruiting events and big events such as Rap Day. I've been the president of the Leaders Board this past year, and I've really appreciated and enjoyed the leadership opportunity. I decided to spend a semester abroad in Ecuador, and I purposely picked a program that had both a classroom and an internship component. My internship focus was public health, and I was able to see what healthcare looks like outside of the United States in a country like Ecuador. I was lucky enough to intern in a sexual health and family planning clinic called Semoplaf, where I helped facilitate public health projects, including a weekly club for girls called Girls Lead Our World, or GLOW. We discussed different topics with these teenagers, ranging from self-esteem to their dreams or to questions about sexual health. Other public health projects involved going to schools and teaching students about their health, as well as venturing into the community to ensure that children in rural indigenous populations received health care. I was also able to see how the clinic functioned as a whole and spent a significant amount of time shadowing a gynecologist. After returning from Ecuador, I realized that I wanted to work with Spanish-speaking populations and make meaningful connections with patients at home in Minnesota. This caused me to find new community engagement experiences, including volunteering as a patient supporter at Planned Parenthood and as a Spanish interpreter at St. Mary's Health Clinics. At Planned Parenthood as a patient supporter, I have felt much more valuable and that I'm truly making an impact on real patients when I compare this experience to my experience in both the emergency room and nursing unit at different large hospitals. At St. Mary's, my work as an interpreter allows me to speak Spanish and help provide healthcare to a marginalized community who wouldn't otherwise have access to it. These community engagement experiences have really shaped who I want to be as a doctor and the kinds of patients I want to work with. As a medical student and after graduation, I want to volunteer in a free clinic and use my Spanish to help serve immigrant populations. During my time at the University of Minnesota, I have found community within the Community Engagement Scholars Program, and I've also found a clearer purpose for what I want to do with my life.